The environment we've talked a little bit about. I encourage you to be in the environment where mouth care is to take place, oral care is to take place, and pay attention. One of the things in the dentist's office now, a lot of folks are using TV as a distractor. They'll have the TV set on because they've learned the thing, if you distract people, they don't notice what you're doing up there in their mouth so much. Be real careful about the TV when people have dementia, because it's actually not a positive distractor. It can actually be a distressor. So it may be when you don't want to have the TV set on, but you do want to have music on, but you don't want to have sing-along music on, because you want them to focus on what you're doing. So you want to pick an instrumental piece that creates a sense of quiet and comfort, something they like and are familiar with. So you want to find out what are some songs that they like that are quiet, that you don't sing along with, so that you can create a background environment that's calming. The other thing I will tell you about environment, warm is better. You want people warm. Go to Walmart and buy lengths of fleece. You know that fleece they sell in the fabric department, if they still have a fabric department? It's just the fuzzy stuff, okay? You want to cut it in about a half-yard lengths, and you want to create a shawl that wraps around the person's shoulders and over their upper arms. And all of a sudden, they aren't cold, they aren't uncomfortable, and they are much more willing to let you up close around their face if they're not cold and uncomfortable. Because what's the other thing that's affected by cold? Arthritis. You feel cold, you're uncomfortable, not going to happen. So if I'm doing things in people's mouths, that actually affects their core temperature a lot more as we move later into the disease. Because when you put something cold in the mouth, the whole system chills. When you put something warm in the mouth, the system warms. So what does that mean about water temperature when you're doing mouth care now? We need to go more to warm versus the cold. And yet automatically many people, if they use cold, are going to just turn on the cold and not think anything about it. But for me, with later stage dementia, oh, no, that's enough. And it's because the cold water. And the other thing, if I do have any cavities that are untreated, estimates 1/4 of people in long-term care with dementia have a dental condition that's unmanaged. Something wrong with teeth that's not managed, or gums. Gingivitis, very, very common. Okay. So the environment, try to up the lighting. Typically, most bathrooms are underlit. They are too dark. People don't feel comfortable in them. It takes 3 times the wattage for an older person, not with even dementia, just an older person, to see the same amount as a young person in the same environment. And you have to have up lighting, not down lighting, because of cataracts. If you do down lighting into their eyes, they will be blinded, because the cataracts make it so it's just glazed now. Now I can't see anything. You also want to look at white on white. Not particularly helpful. So consider the possibility of putting a colored wet washcloth in the bottom of the sink so that they can see where it is you want them to spit. And so give them a target. Give them something to aim at. Also lay a washcloth with the stuff on top of it if you have white on white. If you have a white-handled toothbrush on a white countertop, you want to actually have color underneath so they can find the objects easier. And only put out what you want them to do.